I'll give it a minute while we're kind of giving everybody a minute to get connected. Are you all familiar with the folder system? I always like to tell people about this because it helps me, keep everything straight for my, projects. I find it pretty useful. It's a pretty handy dandy tool. You can add folders and then, organize projects into them if you'd like. Pretty neat feature. Other than that, right now everything is in the development project, so I will start there. I'm going to start with screening. So essentially everything you'll see with the REDCap system will be pretty much in terms of flow identical to the observational trial. So there shouldn't be any surprises. There are differences in data between the two, which you should expect, but I'll go into that a little more once we get there. But in terms of screening, if the subject is not enrolled in the observational trial at all, they're just a new subject who's going to be enrolled in the clinical trial, you would enter them as you would for the observational study, doing the add edit records, or if you would like, you can also go to the record status dashboard and you can enter subjects here as well. But for the purposes of this, I'm not going to go through that step. So you just find your person after you've entered them, go into the screening form, enter that they're in the clinical trial, click yes, consent, etc., and then go through all of the screening questions as you would if you were in the observational trial. It's very similar. So the caveat with the screening is if the subject is in the observational trial already or they're in the clinical trial and then they stop the clinical trial and go into the observational trial. So what do you do with those subjects? So the goal, the original goal was to set it up so you only have to remember one ID per person, which will only be violated if that person is enrolled in the observational trial more than once, but we can cross that bridge when we get to it. It shouldn't happen too often. But for these individuals who are enrolled, let's say this person was enrolled in the clinical trial and they finished, and you need to add that they are now going into the observational trial. So you would just add a new instance of the screening form. You would go in, you would select that they're in the observational trial, and then you would go through that consent as well. So you would just be adding a new instance of this screening form. Does anybody have any questions about that? No? Okay. So that's pretty much all there is to the screening form. It's, there shouldn't be any surprises. If there are, please let me know. I can walk you through them in a little more detail. Once a subject is you've got all their information in here. And oh, and by the way, the automatic emails will also be for the clinical trial as well. So once a subject is marked as eligible and enrolled in the clinical trial here, everyone will receive an email at that time, just so you're aware. Okay. So once you've added everyone into the screening or the person in the screening database, you'll go to the main clinical database. Is here for me. Okay. And if they are a new patient totally to the AlcHepNet projects, you would add them as you would a new patient in the observational trial. So you can either do the add edit records method and select, make sure subject profile is selected and then add their ID, or you can go to the record status dashboard, which is the method that I prefer, and then add them here. So you would want to add them to the subject profile first, like you would with the observational trial. And then once they are here, I'm going to do this subject right here. You'd fill out the enrollment information, the subject profile. You will not see anything to do with randomization or drug dispensing. So these arms will not be visible on your instances of REDCap. So you don't need to worry about those. So once you fill these two out for this subject, you would then, like you are for the observational trial, go in and then register them under the clinical trial arm here. Okay. Does anybody have any questions about that before I show you the two? So the subject profile and enrollment information, there are a couple changes there. that I need to address? Nope. All right. So the enrollment information, again, pretty similar to the observational trial. One thing that we're going to change is we're going to make this look a little nicer and a little more discreet so you can tell exactly which is for which study. But the one thing I want you to be very careful about with this clinical trial is we need you to enter the MELD score for stratification for randomization. So the pharmacists will be randomizing the subject, but they need you, before they can randomize, you have to enter whether or not the subject's MELD score is less than or equal to 26 or greater than 26. If you do not enter this piece of information before randomization, randomization is not possible. So just so you're aware, and there are errors on the side of the pharmacist to let them know that this value hasn't been entered. And if they see that, they can call you and they can enter it themselves if need be. But I would prefer for them to not have to worry about that since they've got a bunch on their plate already. So just make sure that this value is populated here. Okay. And then once the subject is randomized, you will see a message instead of saying subject has not yet been randomized, it'll say subject has been randomized, but you will not see an arm, you won't see a number or anything because you're all blinded. You'll just know that they were randomized and it was successful. Okay. So once you've finished with that form, you move on to the subject profile. Literally the same information as from the observational. Only difference here, and this is going to be a change for the observational trial for you as well as for the clinical trial. The family history information is no longer in the subject profile. I had to move that to the study-specific arms because the clinical trial is not allowed to collect family history information. So you will not be entering that here. And then I will be moving all of that information for you once I update everything, so you don't need to worry about that. But yeah, all this information except for the family history is the same. And if a subject is already in the study, in the observational study, and they go into the clinical trial, you won't have to fill this out again. Just go in and verify that everything is still the same. It should be. The only thing that might have changed is this, marital status or the living situation, but we can address that when we get there. Okay. So once you fill that out, you would go and enter them in the clinical trial, and this is where the bulk of the information is. So it should look similar to the observational, except we're using the day notation instead of week notation to kind of keep them separate. And screening visit is obviously the visit information that was done at the point of screening. The visit form should look exactly the same. There are, different points of information that are collected at different time points with the clinical trial, and so you might see less, points for data entry depending on which time point you're at. So, for instance, screening, you have to collect their, basic medical history, medical or surgical history. For the clinical trial, we want you to list all of those comorbidities and any past surgical procedures that they've gone through. And that's a separate form I'll show you in a minute. Vital signs, pretty much the same, except we have this little safety labs question section tacked on just to make sure that the subjects were checked out before they receive drug, or when they're receiving drugs, that they're, that their labs aren't causing any kind of concern. Okay, standard of care procedures, pretty much the same, except for this other imaging question. This is different between the two. You will not see this in the observational. This is only for the clinical trial, and it just gives you an opportunity to list any additional imaging that the subject may have received. And then you
Excuse me, Jacob, this week. I just stop you here with a quick question. For safety labs, are we specifying what those are? Or is it specified somewhere?
So this section up here is just asking you whether or not they were done. And those labs
are they?
In the lab. So they're in the lab form.
Oh, okay. All right.
Yeah. Mm-hmm. Yeah. So I'll get there. Yep. So the standard of care procedure is pretty much the same except for this one question. Okay. And then a brand new form for you guys to fill out is the sepsis and organ failure scoring. form. That's another safety thing. It's also one of the outcomes that the investigators will be analyzing. So this is some pretty important information. It's the SOFA score, or the Q-SOFA score, which is the quick SOFA. So these are essentially the same, but this one is shorter. And then the SIRS sepsis and septic shock criteria questionnaire. And then the timeline fallback. That's all screening. Anybody have any questions about the screening visit in general?
Yeah, Jake, on the bottom, there was something about question 2, organs failing. What's that?
Oh, that's probably should be a less than sign, and it's between my
No,
upload.
down, lower, near the bottom. There, right there.
One? Oh, yeah. Evidence of greater than or equal to 2 organs failing is what that should say.
Oh, okay. All right,
that's
thanks.
Weird upload error. I'll fix that. Yep. Any other questions? Alrighty. Yeah, the question mark should be greater than or equal to or less than equal to. Okay. On the labs. Labs are a little different depending on, observational and clinical trial. The clinical trial collects more chemistry labs than the observational because of the safety issues. But all of this should look exactly the same to you. And once we get to the follow-ups, there'll be a section on like pregnancy tests and whether or not, they fasted prior to safety labs being taken, things like that. So it's the same mechanism for entering, missing information. Shouldn't be any surprises. I don't think there's anything too different here in terms of how the form works. It might look a little different, but that's about it. Okay. Liver biopsy, any of the bios, oh no, I take it back. So liver biopsy form is the exact same form from observational and clinical trial, but I believe that you don't need to worry about this. This will be the studies pathologist who fills this information out. Correct me if I'm wrong, Peter, but there for you to look at. Another new instrument that you'll need to be aware of is the electrocardiogram.
Sorry, Jacob, this is Monique again. Does that mean we get it from the report, the pathology report?
So my understanding of this, and Peter, if you can, elucidate if you know, was that we have an actual pathologist on AlcHepNet, and that pathologist will take the tissue read, do some kind of quality control, and then they'll enter that information here. And if that's not the case, then yes, it'll be from the actual pathology report that you received from the pathologist at your institution.
That's my knowledge, Peter. Correct me if I'm wrong here. We don't have a specific pathologist for AlcHepNet here at UMass.
I mean,
there were discussions a long time ago. It might have fallen through the cracks, but the last that it left off is that there was a study-wide pathologist who would be filling out this information when I was talking about this with Amy.
Okay, is there any way because this is news to me, is there any way we can, confirm that one way or the other? Do they have, do they have access to REDCap? And
yeah, we can.
I mean, chances are here very slim that we'll have many liver biopsies for this patient population because they're not routinely done. But it's important point to be aware of, and I never heard this before, so.
Yeah, we'll let you know.
Okay, thanks.
Okay, so the electrocardiogram, it's a pretty simple form. The only time I believe it has to be administered is at the screening visit. Any other time is a safety lab type situation. So this is the only event that it is a form like specific to, and it's just these basic pieces of information. I did get a question, I believe it was about PR interval and an equation to calculate PR interval. and the discussion that we had, you know, with the DCC is that it's a pretty common calculation, and it's just a couple, you know, addition, subtraction, so it shouldn't vary from site to site, so you should be good with how you're used to completing the PR or calculating the PR interval, just for those of you who are wondering. It may have been QT number, one of these two. And that's the screening visit.
Sorry to keep interrupting because it's Monique again. So if an ECG was not done as part of standard of care, which they often aren't for this patient population, the PI has to order one, assuming they're inpatient and there's no reason for them to have had an ECG during the admission. So, is that correct?
I believe so, yeah.
Okay, thank you.
And then from here on out, it's pretty much the same, no surprises. The information that you see from day 0 to day 7 might look different in the visit form, but after day 7, it's completely the same from day 14 to day 180. So you'll see everything is the same here. I'll show you here real quick. The same mechanism here, medical information, liver disease scoring, vital signs, standard of care, physical exam, sepsis, and then the questionnaires. So this is the full set that you'll be collecting. But then once you go on to day 3, it's a shortened set because it's just making sure that essentially they've started the drug. You want to make sure that their body isn't reacting negatively, so it's more safety for day 3 and then day 7 as well. Let's show you day 3. So you don't have as many, you don't have the questionnaires here, you just have essentially whether or not they're not doing poorly all of a sudden because of the drug. Day 7, same deal about day 3, and then day 14 to day 28 is a full visit. Okay, so medical information. This is a little unique. So at screening, you'll be collecting some specific points. I'll go back real quick and show you. And then at follow-up, you're essentially asking them if anything has changed, and if anything has changed in terms of their medical history, you'll be updating the specific medical history form for them. So at screening, you have, you know, have you been diagnosed with ascites, you know, encephalopathy, et cetera, et cetera. But once you get to the later visits, follow-up visits, you only should see, this isn't working right now, but you should only see, has anything changed? You should only see this data point. And yes, then you need to go enter it in this medical and surgical history form. That's the only caveat with the medical. Oh, go ahead.
Jacob, I'm sorry, this is Lisa. So are these all just patient self-report on these follow-ups, or are we supposed to be looking through their medical records to find this information?
So like the liver disease scoring, vital signs, standard of care, if you can find it in the medical record, that'd be great. We want the most accurate information as possible since it is a drug trial. We need their actual, you know, vital signs, like BMI and all that stuff, that we would prefer to not have that be self-reported. Obviously, blood pressure, safety labs.
Okay.
Yeah, and X-rays, like all of that, it should come from the medical record just to make sure we're keeping them as safe as possible. But obviously, the questionnaires will be self-reported. Okay. Ready? And then, yeah, from here on out, the visit forms look exactly the same. And then I will show you a couple of new things. tricky. So there's a bunch, quite a few days. So if for some reason you're on this page and like, oh, it's not displaying properly, make sure you scroll down and find the second scroll bar. I don't know why REDCap designed it like this, but they did. Scroll all the way over. So this is where you will enter their medical record follow-up. So once they've passed through day 180, if they do need any sort of medical record follow-up, ConMeds will be here as well. And it's the full ConMed spread. So this is not like the observational trial. It is not just specific medications. It's everything that they've received that needs to go in here. Let's go back. And then medical and surgical history is a new form. And this is a place for you. It's similar setup to the ConMeds. You'll indicate whether it's a diagnosis or it's a surgery, and then you'll go in and you'll provide the name for said diagnosis or surgery. Tell us what body system and the date of diagnosis or surgery. If then there's just one instance, then you'll have to add a new one. I believe they then add a new instance to add a new diagnosis or surgery. So that'll all go in that one. It'll all go in that one spot. Okay. And then a couple of new forms that are specific to the clinical trial or the drug holding form, end of treatment form. So drug holding is if the pharmacist sees that the subject's labs are for some reason, skyrocketing or plummeting to a point where they shouldn't be, they might have you hold the subject's treatment and they'll receive placebo instead. You'll have to fill this out. Pretty standard. It's just a safety thing to make sure whether or not, nothing's going wrong and the reason for holding the study drug. Then end of treatment form, because they can end treatment at any point, like the end of study does not necessarily, or end of treatment does not necessarily mean end of study. We have this form so you can let us know that they've finished their treatment or no longer taking any of the study drug. And so the end of study form would need to be filled out once they finish study, but if the end of study form is filled out, this end of treatment form has to be filled out, but if end of treatment form is filled out, end of study form doesn't necessarily have to be filled out. Does that make sense? I feel like I explained that in a really weird way. Yeah, and when you come to that, I can help you. It's not a huge deal. Just give me a call. This just lets us know that they're no longer taking the drug. Okay. Adverse events, same as the observational, nothing new here. Okay. And then this form, the unblinding form, for emergency unblindings, we do need to keep track of every subject that has been unblinded to, one person who should be blinded at minimum. So every time that occurs, we need you to fill out this request form / documentation form. So we can keep track of that and report it as applicable. And that's pretty much it. It's very similar to the observational trial. Shouldn't be too many surprises, if any, for you. And if you're, as you're going through this and if you're not sure of how to enter something or how something works, just let me know and I can help walk you through it. I'm happy to do that. So does anybody have any general questions about the flow or anything? Okay. Make sure, for the observational trial, things that you'll need to keep in mind right away once I do make these changes, just to reiterate them, is that the family history is no longer here. You'll have to go to the specific observational trial arm to get to the family history form. It's separate now, completely separate. And also ConMeds is no longer here in this arm 1. It is now in the study specific, since the observational trial is collecting a very limited ConMed set, and observational is collecting limited, clinical trial is not. So all of that information will go here, and I'll transfer all of that for you, so you don't need to worry about it. It's just a location swap on your end, but it'll work exactly the same. And then, let's see, something you will need to keep in mind if you have a subject who is currently on the clinical trial or the observational trial, and then they end their participation in the observational trial and then go to the clinical trial, you'll be using the same ID for both, so you shouldn't have to update the subject profile. Just keep that in mind, reiterating it once again, and then you'll just mark that they're in both here so that we know. And then again, register them under the correct arm, and then we'll have some checks just to make sure everything's going correctly as well. Okay. I think that's about it. I can't think of anything else that I need to tell you. Does anybody have any questions? Would anybody like some training subjects to enter, access to the trainings or the development site so they can like poke around? I'd be willing to set you up with that.
Yeah, I would.
Okay. I'll do that for everyone. I'll give everyone access, and I can put together a couple of fake patients for you to enter that's non-mandatory, just so you can kind of see how it'll go. Okay. I think that's about it.
Jacob, I had a question. I thought with re-enrollment of patients, we were going to use a different number and then mark that they were in both.
For re-enrollment of observational study only. So
okay.
Since that is going to, I guess I can talk about it now. I don't want to confuse everyone too much, but there is the possibility that someone who is in the observational study, if they present with a new case of alcoholic hepatitis 24 weeks after their original enrollment ends, that they can be re-enrolled in the observational study, okay? And we're expecting that to be a very small subset of patients, So if that is to occur, that re-enrollment in the observational study is a new ID. They're treated as a new subject from the get-go, just to keep them very clear. But we will have a spot for you to kind of connect the records. So we'll have you enter a previous ID in a text field, and just so we can know, who's who and who is a duplicate on our end. But that shouldn't happen very often. And once you get to that point, I can walk you through it. But that was kind of our workaround with that. But if they're in the observational trial and then they're enrolled in the clinical trial, or if they're in the clinical trial and then the observational trial, you'll use that first ID. That will be the only one that will be the same between clinical and observational. Does anybody have any questions about that?
You.
Yeah. I know it's a little confusing right now. I tried to, but we'll cross that bridge when we get to it. We don't expect too many people to have to go through that. Because the clinical trial screening criteria are more strict than the observational trial. So it's likely that if someone is re-enrolled in the observational trial, they won't be eligible for the clinical trial. So you won't have to worry about that. All right, that's all I've got for you then.
I will stop recording.